Virtually every woman of reproductive age now has been exposed to HPV. We think it's around 80 million people. Now, not every man is going in and getting the screening, so it's probably an underreporting. But 80 million people per the CDC in the United States alone are coping with this. So if you feel alone out there, if you feel isolated, you're not. Like, this is not something to be ashamed about any more than miscarriage is something to be ashamed about.
The way that I sometimes talk about it is like, it's so common that it's like the common cold for your cervix.
Absolutely. Yeah.
So it's like anyone who's having sex or even in close contact, skin to skin contact, is potentially at risk with being exposed to HPV.
That's right. That's right. Hey, everybody. Welcome back to the Holistic OBGYN podcast. I'm Nathan Miley, MD, board certified OBGYN, board certified hospice and palliative care doc. I've got this great podcast called the Holistic OBGYN. And what you're about to hear is an interview that I did with Mimi Lindquist and Chase Ramey of the Medicine podcast. We're repurposing it onto my show because Mimi and I are launching this incredibly awesome opportunity in order to take back your immune health, your overall well-being, specifically through the lens of persistent HPV or abnormal pap smears, right? What your OBGYN will generally do is collect your swabs every 3 to 5 years, depending on, your circumstances. And then if one of those is abnormal or both is abnormal, they're going to say, okay, well, hey, don't worry. Come back in 6 to 12 months, again, depending on your circumstances. And we'll repeat the screen. And if one of those continues to be abnormal for a given period of time, you may find yourself with a confirmatory test called a cervical biopsy, where they take a chunk of your cervix out, send it to the pathology lab, and they look at it under the microscope to tell you if you have advanced cervical intraepithelial neoplasia or maybe even invasive cancer. Well, what's missing from that, and while I recommend everybody continue to stay very diligent about these screening modalities, what's missing from that is that no tools, no insights, no information is given to any women or their partners, for that matter, around how to interpret these results. If HPV, this little stinking DNA virus, is sticking around in your body, it tells us that there is something going on with your immune system. Perhaps it's in the gut. Perhaps it's on the mental, emotional, or even spiritual levels. There's a whole bunch of stuff that leads to a body that is unable to integrate the message viruses, which outnumber bacteria 10 to 1 in nature. If viruses were these contagions looking for us to come and get us, to destroy us, they would have already done that. So perhaps our relationship to viruses needs to be reframed. And most importantly, while you're awaiting that repeat screen, why not start to dial in your health? Maybe this HPV, that just this pesky thing that won't go away, that your body won't integrate, such that it comes up negative on your HPV screen, or comes up negative on a pap smear. Perhaps there's a signal here, and that signal might be suggesting, hey, I've got to get my health in order. So Mimi and I have put together this program very much in the same spirit of the Born Free method. In fact, they're under the Born Free umbrella, both of them. We put together this program. Mimi's a health coach. She actually started her career as a dental hygienist and became fascinated with the use of functional mushrooms, specifically the mycelia of shiitake mushrooms, and developed a product called Immune Intel AHCC. That, combined with a variety of health coaching practices, she's been able to help women clear persistent HPV, which loosely can be defined as HPV that doesn't go away after 2 years. You may find yourself with one of those painful cervical biopsies, or heaven forbid, advanced neoplasia or even invasive cancer, if something isn't done in the meantime. These procedures whereby we remove chunks of the cervix like a leap or like a cold knife cone, they don't really fix anything. They remove the abnormal cells, but why are the abnormal cells developing there in the first place? There was some really, really great research by a guy named Jonas Folkman, which really confirmed that we have cancer cells all over our body at all times. But if you have a strong immune system, if you're sleeping well, moving well, eating well, setting adequate emotional boundaries, have great intimacy in your personal relationships, if you're hydrating well, if you're spending enough time quiet in solitude and meditation, you probably aren't going to have an issue with this. But that's not what the conventional model provides. So in this episode, you're going to enjoy a very, very action-packed, info-packed conversation between Mimi and I, moderated by her husband, the co-host of the medicine podcast, Chase Ramey. I love these two. I love Mimi, and I loved building this project. Of course, in the show notes, we're going to include any information that you would need if you wanted to come on this journey with us. The program is called Clear and Free, Your Holistic Solution to Persistent HPV. Would love to have you. So look in the podcast description. You'll find a little link there in order to join the waitlist. And from there, you'll be invited. If you feel like it's a good fit, you'll be invited to join us in our first cohort, which starts November 6th. There's a whole bunch of bonuses that are thrown in, including your first bottle of Immune Intel AHCC, which is valued at $90, a one-on-one coaching session with me and me, a variety of other bonuses, including a discounted rate for the early adopters of this incredible program. I bring my allopathic functional medicine, all of the other disciplines that I've studied, I bring that into the conversation. Mimi brings her health coaching and her expertise in the functional medicine world, functional mushroom world, excuse me. We bring those together into this beautiful program, and you're going to hear all about it in this interview. There are no sponsors for this podcast, for this episode. However, I will say Immune Intel AHCC has continued to support the show. So in case you want a little bit more information, or you want to try this product that has been clinically demonstrated to help clear persistent HPV, even when nothing else is done. But with everything that Mimi and I are going to teach you, you're going to be putting yourself into that sort of 1 in a million crowd that this is actually going to be a problem in your life. Remember, there's a signal here, and the signal is you have to do something to dial in your physical, mental, emotional, or spiritual well-being. And we're here to be your guides along the way. So Immune Intel is a product made, as I mentioned, from the mycelia of shiitake mushrooms. Various, countless now studies have been used to demonstrate that this is not only has a very, very low toxicity profile, but it helps to boost the immune system for everything from persistent HPV to autoimmune conditions to treatment-resistant epilepsy and a variety of other neurologic disorders. All of that is available on PubMed, and we have over 140 citations in the bibliography for our program Clear and Free, which, by the way, includes 6 monthly coaching calls with me and Mimi, a group coaching setting, so that you can get back on track and look at this stuff as if it were water under the bridge, and not worry so much about what your OBGYN is about to tell you at your upcoming screening. So Immune Intel AHCC is a product that I use on a quarterly basis, 2 capsules per day. If you were going to use it in order to clear persistent HPV, you could double that dose, but take it for 4 to 6 months, and you will find that you're in the majority of women who can dial in their health. And a lot of these modalities are not expensive. A lot of them are actually quite cheap. You can dial in your health, though. Start taking Immune Intel, and you're going to find that you're happily surprised at your repeat screening in 6 to 12 months, whatever your doctor told you. So go to themedicine.com/products, enter code beloved. You'll save 10% on your first bottle of Immune Intel HCC. I've got a whole case of it at my house because this is something I'm using for all of my friends and family. This is one of those surefire whole food supplements that has been so well studied that it's a little bit hard to argue with the results. In the meantime, please enjoy my conversation with Mimi Lindquist and Chase Ramey. And if you find yourself compelled in any way, please share the episode. Please leave a 5-star review on Apple Podcasts and Spotify. Believe it or not, that actually matters. It actually matters to those of us who are putting out this free public education on the internet. And when we get those 5-star reviews, it bumps our ratings up, and we are very, very grateful for that. So please do those things. And of course, if you want to support the show, otherwise, please go to the medicine, that's MEDICIN, no E, immune.com/products and start stocking up on Immune Intel AHCC. This is maybe the only supplement you'll ever need, honestly. As long as you're eating a healthy diet and you're moving well and sleeping well and all of that. So enjoy this conversation, guys. I sure as heck did.
Welcome back to the show. And I am so honored today because I get to play host to these two beautiful individuals, Dr. Nathan Riley.
Yo.
My beloved Mimi Lindquist.
Hello.
Welcome back to the Medicine Podcast.
Thanks for having me.
I feel like I'm back too. Yeah, like this is really fun.
Yeah,
and now we're in person. We're not doing this in my garage in the cold.
Yeah, it's so good to have you here with us.
I'm so happy to be here with you. I love you guys.
I love you too.
Man.
My hands are a little cold. Sorry, Mimi.
No, it's all good. Yeah.
Last saw you in Louisville.
Mm-hmm.
You had a nice time out there for that conference.
Oh, it was so fun. So fun to be a part of such an incredible event and to like witness you in all of your magic, and the community that you're building and the work that you're doing in the world is so absolutely important. And it was just an honor to be a small piece of that event, sponsoring it and getting to meet your community and see you in action. It was just amazing.
Yeah. People had such a great reception to, we didn't have a lot of companies directly represented there with individuals. And you guys were like, can we come out? And I was like, fuck yeah, you can come out. It'd be awesome to see you. So it wasn't even just the conference. We went into like one of my favorite hiking trails.
Yeah.
You got to meet my little girls and my wife and hang out in my patio. Like it was just, like we're real friends now. We hung out in person.
Absolutely.
You fed us organ meat sausage.
Then we cut our hands and mixed our blood. Like
Right, yeah.
So that was the best part.
We are legitimately blood brothers and sisters at this point. I am so excited to be having this conversation. You two have been planting seeds in a territory that has needed growth. It has needed life. It has needed vitality. And this has been such a labor of love that the blossoming is about to begin, baby.
Yeah.
The growth has begun and the fruiting of these incredible seeds that have been planted is now showing up. And today we get to talk about this incredible program that both of you have developed after years of working with people, after countless conversations and testimonials and your own deep dives into these particular lanes around HPV and the people impacted by HPV. And so today we'll get to unpack a lot of that.
Yeah.
I wanted to start this off with a testimonial that really encapsulates so much of what we're going to be talking about today and so much of what you two have been through in your work. And so I'll read it. This is from an anonymous source, but it reads, I was diagnosed with high-risk HPV 16 and 18 at the end of 2020 and was shamed by my gynecologist. I left the office in tears. After 3 abnormal pap smears, I decided to work with you. After 3 months, I just received news that I am HPV free, and I am now worry free.
Oh man, just immediate like lump in my throat, heart expansion. This is why we do this work.
And this is just one of many that I've been witness to in both of your work over the last few years. And we'll get into this. We'll unpack this and all of what led up to this person's story of clearing. But we're going to be talking about the Clear and Free program today that you two have developed. But before we get into the program, I really want to take a step back for a minute and highlight, educate a little bit about what HPV is. So maybe both of you could take me through what is HPV and who does this impact?
Yeah. Want me to start?
Go for it.
Sure. Well, so I think it's also relevant to point out I'm a guy. I generally am not going to experience HPV in the way that, these women who are writing into you with these incredible testimonials. I'm not going to really ever experience that shame necessarily. because HPV is largely considered this sort of women's sexually transmitted infection. And of course, men can pass that on, and that's a part of the deal here. But there's nothing in my experience as a man that's necessarily going to be directly impacted by this. And I'm an OBGYN. I trained hard clinically and surgically in managing this HPV thing and the cervical dysplasia and all the pap smears and all of the follow-up and looking at the algorithm. Are you coming back in 6 months or 12 months? Like, what's the risk of it developing into, cervical intraepithelial neoplasia, mouthful there, and then maybe cancer? Like, I did all of that. The problem that I really found was, like, I'm giving people this information, but then I'm not really providing them any tools or community or empowerment or really even support in what they can do in order to make sure that not only is my language and the way I'm showing up in the clinic making them feel less shame or less guilt, or but maybe how to talk to your partner about this, or what can I do from a lifestyle standpoint, or are there any supplements out there that can be helpful? I had the impression that there was, but I wasn't ever incentivized or trained to do that. It was just sort of like, well, good luck. I'll see you in 6 months. And hopefully it doesn't get worse, because if it does, then we have to do these painful biopsies and we have to maybe go and lop off a chunk of cervix, which, great. I'm glad I know how to do that. But what are you, the person I took an oath to care for, what are you able to do in the meantime? So you asked about HPV, human papilloma virus. This is there is a transmission of this thing. Viruses are not living things, but it is transmissible through intercourse, through close contact, and other ways. Gay men are also impacted by this. It can form anal cancer in gay men, but the vast majority of people listening are probably going to think HPV, cervix, Gardasil. They're going to go that whole path. So this DNA virus can be transmitted sexually. I don't think we know a lot about what viruses really are, but the way I like to view it, and I know this is part of the reason you and I started working together, is that this can't be a disease in and of itself, because that really kind of strips the power away. Instead, what if we could reframe it as a signal from the outside? It's maybe the pain doctor knocking. I mean, you could reframe this in a variety of ways, but now that you have that signal, how can we respond to that signal? So we were looking through some statistics earlier, and we're looking at incidence and prevalence. This is not a thing that is rare. Virtually every woman of reproductive age now has been exposed to HPV. We think it's around 80 million people. Now, not every man is going in and getting the screening, so it's probably an underreporting. But 80 million people per the CDC in the United States alone are coping with this. So if you feel alone out there, if you feel isolated, you're not. Like, this is not something to be ashamed about any more than miscarriage is something to be ashamed about.
The way that I sometimes talk about it is like, it's so common that it's like the common cold for your cervix.
Absolutely. Yeah.
So it's like anyone who's having sex or even in close contact, skin to skin contact, is potentially at risk with being exposed to HPV.
That's right. That's right. So if on average, we're looking at roughly 14 million per year being added to this pool, this is a problem that I think impacts everybody. So you asked, who is this program for? Who's this conversation for? If you have a cervix, it's definitely for you.
Yeah.
If you have sex with somebody who has a cervix, it's definitely for you. If you have sex with somebody who, and you have anal sex, it's probably for you. But more importantly, it kind of goes back to my roles in OBGYN. I'm not just a doctor. I've got 2 little girls. I've got a wife. I've got a sister. I've got a mother. I've got plenty of friends, female friends in my life, who are definitely struggling with this conversation. So I think that everybody should be invested in this conversation. And in the program, we actually get into the immune system. We get into vaccines and all the adjuvants. Like, we really cover a broad array of topics that tie into this, which is why I think it's a really fun place to start with who is this for? And there's nobody out there whose life is not going to be touched in some way by the way that our conventional medical model handles this very, very common, quote, infection. I'm using air quotes on my end. Yeah.
And getting back to a little bit of the HPV basics, we speak about this virus as if it's one virus, but we know that viruses mutate, they change, they evolve, and it's actually a cluster of viruses or strains. under this umbrella that we call HPV, or human papilloma virus. And there are kind of buckets of low risk and high risk strains. So depending on what strain you have, it might show up or manifest differently in the body. So generally, the low risk strains are going to be associated with things like genital warts. The high risk strains are probably not going to have any physical manifestation or symptoms. You're going to see it come up if it progresses. You're going to see it more so associated with cervical dysplasia and cells sort of mutating and becoming damaged on the cervix, which, if that's left untreated or if it continues to progress, can progress to cervical cancer. So that's why they call it high risk. And low risk meaning, yeah, you have genital warts, but you're probably at a very low risk of getting cervical cancer. But you can have co-infection of multiple strains. So someone could have something like genital warts, but they might also have a high-risk strain in there as well that their body is not able to integrate for some reason. And they might also have the beginnings of cervical dysplasia. So I want to make that really clear, that just because you are diagnosed HPV positive, don't immediately jump to, oh my God, HPV, that's what causes cervical cancer, right? There's so much that happens, that has to happen, usually decades.
Yeah.
You can correct me here or add here, but usually decades before it develops into something even remotely close to cervical cancer. So I just want to put that out there in the very beginning, because oftentimes the women who find me, they had just come off of Dr. Google, which can be really
very scary,
frightening, alarming, and especially if you don't know how to read your results well, you might not even know what strain you have. So that's really important, I think, to put out there in the beginning.
Yeah, you can go to WebMD and find yourself in a spiraling stress, whirlpool down
I'm having
to
a stroke
hell.
right now.
Yeah.
Oh my gosh.
So I definitely want to get into, what are people seeing when they Google this thing? What's the mainstream approach to it? But I'd love to hear from you before we get there, both of you, and maybe we'll start with you, babe. Each of your experience, in this case, mostly with women likely, but each of your experience working with those who have either directly or in a lot of cases indirectly, whether it's a loved one or someone they care about in their life deeply, been impacted by HPV. What does that look like for both of you?
Yeah, I'll start. So I am classically trained. My degree is in dental health science. So I am a dental hygienist by degree. And in my work as a clinical dental hygienist, every single patient that comes in, I'm looking at their medical history and updating it every single time. So I started to see, back in 2016, 2017, a lot of women that have this diagnosis, and they're sharing it with me. They trust me. I'm, a medical provider of sorts, and seeing this trend that it is very, very common. And in my work as a dental hygienist, my focus is on disease prevention, and not only of the mouth, but the mouth is just it's the gateway to the body, and it's important, but it's connected to everything else. So being the avid health enthusiast that I am and that I became, I was always looking for ways to help my patients, not just with their dental hygiene, but really to hopefully inspire them and educate them in a way that helps them take full ownership of their health, not just their teeth, but like, what's the rest look like here? So I was constantly, writing on little Post-it notes, certain podcasts or books that I think could be helpful for this person. And so very early on, that was a huge passion of mine, is educating in a way where someone feels like, you know what? I've never really heard it put it that way. I'm going to take that to heart and I'm going to do something with it. And education was really my most favorite part of being a dental hygienist. You're seeing 8 to 10 patients a day, and every person is different and new. And you kind of are figuring out this puzzle together. And it was really, really rewarding to see people every 3 months or 6 months come back and see how their life is improving, how their health is improving, certainly their oral health, but like, how's everything else, you know? So I took that very, very seriously in my work. My work as a dental hygienist then led me down a path of discovering and really diving into the world of medicinal mushrooms. And in my own health journey, I took a step back from dental hygiene, and I really just decided to focus on myself. I was working through a lot of, you know, people know some of our story, but we were divorced, Chase and I had a lot to deal with in my inner world. And I was just in a really high stress environment. So I took a step back and just started to focus on myself, healing my insides, and really put all my creative and work energy into medicinal mushrooms, holistic health, and sharing that on, you know, Instagram. And as I was doing that and, you know, going to these events like in Japan, the International Congress on Nutrition and Integrative Medicine in 2019, I had a front row seat to researchers and physicians from all over the world that were presenting the new research on AHCC, active hexose correlated compound, and all sorts of different diseases and conditions, one of them being HPV. This was an unpublished at the time, but it was ongoing. It was this phase 2, double-blinded, placebo-controlled sort of gold standard of research led by Judith Smith out of Texas. And she shared these incredible results for clearing HPV. And when I heard these results, my jaw was on the floor, and I was just like, I have to share this, because from my work as a dental hygienist, I was seeing how many women were dealing with this. And I was also sharing on Instagram, and they were coming to me, you know, with my work on AHCC. And when I got back to the States, I just started blasting it, you know, and I would go on different podcasts and share what I knew. And women would inevitably find me, DM me. I would have hundreds of women in my DMs after these big shows that I would do, just desperate for answers. And it just like, I get like emotional even thinking about it sometimes right now. The stories that were coming to me were just heartbreaking. And realizing that these women felt like they had no one to turn to. They had a doctor, yes, but they weren't getting help from their gynecologist. There was so much lack in education around this thing, this HPV thing. And they were just desperate for help, for answers, for guidance, for a fucking friend who wasn't going to shame them, who could maybe point them in the right direction. And I would get so overwhelmed hearing about the shame associated with this virus because it is sexually transmitted, and because of all the underlying gross, shameful things that we connect to sex in our culture. There's a lot of shame around sex, yet it's plastered everywhere.
Right.
And people feel like they can't talk about this very intimate space just out there on the web. Like you just don't see people talking about this because there is this shame associated with this virus, even though it is the common cold. It is the cervical common cold.
80 million people.
With how common it is. But I was hearing words from these women like, I feel gross. I feel dirty. I feel ashamed. I don't even want to have sex with my partner. Am I allowed to date? Is it unethical to date or to have sex? And just no answers out there, not only from the mental and emotional side, but also from the physical side. Like, what can I do to help my body? Is it really only the vaccine? Is it really only like scraping off a piece of my cervix that's going to help this? And so I really started to see the need and continue sharing. And it has brought me to this point where I cannot help. There's so many inquiries and women and partners, men find me too, but it's mostly women who need help in this space. And I just, we just don't have a good option that addresses the physical, the mental, the emotional, the relational, and the spiritual on every aspect. And I just knew that I needed to create something that could help anyone in the world. And that's, this program needed to be created 4 years ago, but all the puzzle pieces of my life needed to come into place in such a way where it's meant to be. It's on time and in time right now, teaming up with Nathan and his expertise and his direct clinical experience and the women that he works with. Everything is perfect the way that it's working out. And I'm just so incredibly proud and honored to be able to help women and finally have an answer for these women who are desperate for answers. So that's been my experience. And I'll kick it to you, Nathan.
Jeez. I went to med school and then I decided I wanted to team up with Mimi. No, man, it's hard to follow up you bring such passion to this work. We've been, shooting the shit all day today. And the reason I love working with you, both of you, is, and this is even related to coming out to the conference, is like, you can show up in a couple ways in the world. And if you're not going to do something and put feet on the ground, like, what's the Brene Brown thing? Or, was it a Teddy Roosevelt quote? Like, if you're not in the arena, like your opinion really is not valuable here. I'm paraphrasing Teddy Roosevelt, but anyways, I guess, finding somebody who actually has that passion towards like, I just want to do this thing that I know is going to be helpful to so many women in the world. And as a woman, you can relate in such different ways. Of course, my story is a little bit different, but after I went through residency, I did a fellowship in hospice and palliative care, which I think we talked about when we did a previous interview. And in both my role as an OBGYN, especially as a chief resident, as well as, of course, my fellowship at UC San Diego, where people would come for third or fourth opinions, Hail Marys for their, unusual cancers and whatnot. It's a massive cancer center down there. We saw so much cervical cancer. And us doctors, when we have specialties, we tend to have this like tendency to think this is a really common problem because I'm seeing it all the time. But of course, you're not seeing the other 9 billion people, not 9 billion, 7+ billion people who didn't get cervical cancer. And having said that, this cervical cancer thing is it wreaks havoc on a person. It's the most vulnerable space in a woman's body. And so they develop this cancer, and of course they feel shame, and they can't have sex anymore. So towards that very end of life, they want to be intimate. Like there's radiation treatment. All the chemos knocked you out. I mean, maybe there's a massive surgery that took place. That's actually less common because cervical cancer spreads in such a way that surgery sometimes is just like not useful anymore. So this is a tremendously tragic event. Unfortunately, it's very rare. But I was watching this and I was like, gosh, like this 34-year-old with 4 kids now is going to die of this thing. And she probably saw the same campaign posters I did when I was in college that were like, one less, get the HPV vaccine. I'm sure we'll get into that history. But if you don't remember, guys, like this HPV vaccine that every little kid down to the age of 9 now is supposed to get, like that was the promise. That was like our salvation from this. And we haven't seen a lick of difference in the actual number of cervical cancer patients walking through the door. So all of this is to say that, going back to what I was saying about being an OBGYN trainee and working in a clinical practice as an OBGYN, it was like, the next step is to do a biopsy. And I can't tell you how many people have said, there was one woman who said, I'd rather die of cervical cancer than have another biopsy.
Wow.
Because it was so painful. So the way we do it, just for anybody listening, it's maybe a little graphic, but you put a speculum in and you look at the cervix, and then you can either apply like an iodine-based solution or even acetic acid. And then where you see the most prevalent changes or lack thereof, you then will go with this little thing that kind of is like this. And you literally go and you pop them in and rip out.
Like a claw.
It's like a claw, and it takes a chunk of your cervix, which has a ton of nerve endings. And we would use like lidocaine and whatnot, but this is a tremendously painful thing. Imagine like somebody coming and taking a chunk of the tip of our penis off.
Right.
Or something.
It's a medieval.
Yeah. It's like, it's numbed up. Like, are you sure? I mean, like that's a pretty gnarly thing. And what now has happened is colposcopy's kind of flown away is we do random biopsies. That's actually been shown just as effective at finding abnormal, really either invasive cancer or this advanced CIN that we've been talking about. And every time I did it, it was like my attendings would get mad at me because I didn't get enough tissue, because I was like afraid to do it. I was like, oh my God. And so, taking a step back from all of that, the entire time I was thinking about cancer. We know that in general, cancer takes, on average, any type of cancer, probably about 10 years. Like, your body has been working on this for 10 years. And at some point it wasn't able to fight the fight, and the cancer overwhelmed the immune system. And so that got me like reading quite a bit of literature. Like, we're talking peer-reviewed journals, New England Journal, Lancet, like Cell, Nature, big journals around how the immune system was related to cancer. And, AHCC is such a beautiful product. And I'll tell you, a little bit more about that in my experience, because it actually enhances, it interconnects your nervous system, and it boosts up all the right cells so that you can, you can meet the cancerous cells like on the playing field. And so then it was like, well, okay, so if the immune system is related here, what else are we doing for them? Like, we're literally doing nothing. In fact, we're giving you poison that's going to wreck your immune system in hopes of curing the disease. So anyways, all of this is to say that I've been thinking about this for a very long time. And with 2 little girls of my own, this salvation of Gardasil 9 also was like, okay, got to look into that now. Because what happened with COVID, I started thinking about, can I really take this for face value? Like, I am not going to believe anybody. It doesn't matter what your credentials are. I guess I need to go and do the research myself, because this is becoming too confusing. And then I got really deep into the hole around Gardasil 9 and the history of Merck and Vioxx and the safety and efficacy of every single vaccine that had been pushed on my little girls, which fortunately we were able to push back. But this Gardasil thing is going to be a real conversation between my wife and I, because she also saw those same campaigns back when we were kids. So all of that is to say that as a male who is reflective of the conventional medical model, which I think has made so many women feel shame, which has done a lot of harm and a lot of good.
Sure.
But a lot of people are not necessarily stoked about going to their gynecologist. So given that that's my background, having somebody like you, Mimi, and finding your work, and honestly, I can't even remember how we all met. Maybe it was through Paul Chek.
Yeah, I think it was.
Was it? I remember finding your work, and then you had sent me a study that came out that showed that with pretty conclusive, let's say a really great demonstration as to how some basic stuff that we do in the environment, and maybe adding some directed supplementation for a period of time, not for the purpose of having a bigger boner in the morning and going out and getting it David Goggins style, but really just to give the nervous system or the nervous system and the immune system a little support, so that they can look ahead to that 6-month visit and they walk away feeling like they just got a no cavities at their dentist. They used to feel so great as a kid. And while they're not necessarily comparable, it's one of those things where if I was going to go back to the dentist and I didn't brush my teeth ever, I wouldn't expect a different result. And now I think we have a way of building a bigger conversation around what can be done in the environment in order to support the clearance or the integration of this virus, and so you can go on with your life and wave goodbye. It could still come back in the future, but you have the tools to just keep dialing this in every step of the way. And I'm hoping to be able to impress that upon my girls as well, because I'm not super stoked about the vaccine either.
And so let's get into that. Let's walk me through what the mainstream current options for treating HPV looked like, and maybe even a little history of the vaccine, because we mentioned the vaccine. You mentioned a cervix scraping, which sounds brutal, but what does it look like if someone Googles, HPV treatments or goes into their doctor and they hear that they've got HPV, and what do the next steps typically look like?
I can start, and then maybe you can jump into the vaccine.
Yeah, totally.
So the quote unquote solutions or the treatment options that are out there, if you have an HPV positive result, positive screening, and we'll speak to the high risk strains that can lead to cervical cancer. So these are quote unquote solutions that are not actually solutions. So the first that they might hear is okay, just come back in 6 months. Or, okay, yep, you got HPV, come back in a year and we'll retest you. Well, that's not a solution. That's a waiting game. And she's left in the meantime wondering, what the heck? Like, I just come back and like, is there anything I can do? Like, is that it? And what I hear from women a lot is the gynecologist sort of acts like nonchalant about it. There's not a lot of education. That's a vast understatement. There's hardly any education going on. And so the gynecologist is probably diagnosing 3 to 5 people a day with HPV because it's so common. And so to her, to the gynecologist, or him, to the gynecologist, it's not actually a big deal because she knows that the majority of people who get diagnosed with HPV can clear it just fine. But there's a subset of people that cannot. And so she's telling the individual, yep, just come back in a year and we'll retest you and we'll
Most
see.
people clear it. Yeah, I'm sure it's fine.
It'll be fine.
Yeah.
Come back in a year. It's a waiting game. It's not a solution. The next quote unquote solution that they might talk about, depending on how far it is progressed when you get that diagnosis, is a procedure called a LEEP, a loop electrosurgical excision procedure. And this is when they go in and sort of cut, or they use a hot wire basically to slice off a piece of the cervix that has the cervical dysplasia, the damaged cells. So they're literally taking a portion of your cervix away. That's sort of like going to the doctor and having a wart frozen off. It gets rid of the manifestation, but it's not actually treating the body. So that's another solution that is not actually a solution. And it's kind of heartbreaking because a lot of women that find me, maybe they already have had a LEEP procedure and they think that that got rid of the virus. So there's a lack in education going on there as well, because you're just removing the damaged cells. You're not actually clearing the virus from your body. So that cervical dysplasia can come back. So that's the next non-solution solution that they give. And the third non-solution that they might recommend to a patient who's HPV positive is to get the vaccine, Gardasil 9 vaccine. This is a very hot topic, and I have to like sort of keep myself kind of calm when I talk about it, because it's truly maddening when you are able to really dive into the research and look at the data and look at the outcomes, look at the risks and everything that goes into this vaccine conversation. But the thing that's most disturbing to me is that these gynecologists are recommending a vaccine for a person who already has been tested screen positive. On the CDC website, the main page for the HPV Gardasil vaccine, it says, this vaccine will not treat or cure an existing HPV infection. And I'll kick it to Nathan here, but I'll close with saying, and there is some research to indicate that shows that if you have been exposed to HPV and then on top of that, you get the vaccine, it can actually have negative efficacy, meaning that you might be more likely to get it, have cervical dysplasia that can lead to cervical cancer if you've already been exposed. And I'll kick it to you, Nathan, to talk about the vaccine a little bit more.
Yeah, totally. I think it was very well said. Thank you, Mimi. I think it's important for us to go back to some of the principles that the sort of presumptions we have around disease and cancer and healing, which kind of prompts two stories for me to illustrate this. So cancer, of course, is something, the big C word, we don't want to hear it. And we have long been invested in this idea that your genes are responsible for the development of cancer. And while that's probably partly true, they have done actual, molecular biologists have taken we've taken our healthy cells and a group of cancerous cells, and they flip-flop the nuclei, and the healthy cells remain healthy and the cancerous cells remain cancerous, which tells us it is at least not entirely the genetic material which lives in the nucleus, this little organelle of the cell. They probably wouldn't call it an organelle, but whatever. This little area where all of the chromosomes, all the genetic material lies. So that tells us that the majority of the cell, the cytoplasm, the environment around the genes is actually more important. The other story I can tell, which is something that came up over and over and over again at our stem cell transplant center up at UCSD, whereby, if a person has, let's say, leukemia, one of certain types of leukemia are going to be best treated by blasting you with such high dose of chemo that your bone marrow is completely blown apart. So no white cells, no red cells, no platelets. Your bone marrow has been scorched. And without bone marrow, without any of those cells, you're going to die. So what we do is find a donor that is not likely to have you're not likely to have an immune response to their blood cells. We take an aspirate from their bone marrow and we now put it into you, such that we've now reoccupied your bone marrow with, quote, healthy bone marrow. Leukemia can't develop out of healthy bone marrow because it developed out of the unhealthy bone marrow that you were living with. Well, the majority of the time, the leukemia comes back. So what the fuck? Again, it's the environment. Something upstream hasn't yet changed.
Yeah.
So speaking to the prevention, that's really where I think most of us are concerned. But we have to bear in mind treatment and prevention need to be done simultaneously while we sort of bridge us to a point where we have less and less and less to treat. And then we can just wholeheartedly say, we know a way of nixing this whole thing for the rest of history. Doesn't really happen like that, but that's the idea. So do you want to go just into the vaccine now?
Yeah.
Okay.
Because it seems, from my seat, it seems as if the intention of the vaccine is prevention,
Mm-hmm.
which is
Exactly.
also an odd treatment option if it is meant to be preventative. But then it sounds like there's some downsides to even the use of it as a preventative medicine.
Right. Yeah. So let's talk about Gardasil 9. That's the primary vaccine that is advertised, again, to kids as young as 9 in order to prevent cervical cancer. The idea, of course, there being that they aren't likely sexually active until maybe their late teens or something. So we got to get it in early. So we're talking like middle school age, right? Isn't 9? Oh, that might even be elementary school.
Yeah, it's elementary.
Grade.
Yeah.
So, but right before I do that, for those who are maybe kind of new to this screening and you're just curious about what is the recommendation for how often to go for a pap smear, also known as a Papa Nicolau exam or a Papilloma screen.
It might be a scream.
There's a lot of hard words in this episode. So when you go back to your OBGYNs, roughly at, I think it's like 21 to 25 is really when you start that. Before 21, it's not necessarily considered like a normal thing to do. Again, because it takes so long for this stuff to develop. But you're going to oftentimes be presented on every 3 to 5 year basis with an HPV screen, which looks for those high risk strains, most notably 16 and 18. And then you're also going to get a pap smear. A pap smear is like a little pipe cleaner that goes into the cervix. And then we take it and we smear it on a microscope slide and we see, does this look like there might be cancer there? Like abnormal cells? Just a little, it's a screen. And then the HPV test, is it positive or negative? And then we take those two values and we determine, is there enough information here to warrant a biopsy, which is that painful claw thing I talked about? And if that shows that you have CIN 1, 2, or 3 or whatever, then there's going to be a decision made as to when do we repeat this, right? And again, there's not much information given to our patients in order to work on this so that maybe we can sort of improve the likelihood of this regressing, meaning going backwards or going away altogether. And if it does progress sufficiently, you might be finding yourself with a LEEP or a cold knife cone, or maybe even cervical cancer, which again is super low. It's less than 1% chance of getting cervical cancer. I mean, it's a pretty darn low risk. But anyways, so that's the basic prevention model. And then with the introduction of Gardasil 9, there was this promise that, hey, you've got the 2, it's either 2 or 3 doses, depending on when you get it. But it's, even if you just got 1, let's just say you did the 2-dose course. Now that you've done that, you're now protected.
That's what they say.
That's what they say. That's what has been advertised. And wow, wouldn't that be great? Like I felt very fortunate that we had that when I was a resident. And it wasn't until I think later, as with many things, that you start to wonder, like, is this vaccine really working? And then of course you consider what's in vaccines and you end up with a slightly different picture. So from the standpoint of this vaccine, I think it's important to give a tiny little bit of history around Merck. Merck is the company that manufactures Gardasil 9. And we don't hear much about Merck because Merck was hit with about $14 million in lawsuits in 2007 for an alternative to ibuprofen called Vioxx. It's not really the same. It was a brand new novel therapy that worked like a non-steroidal anti-inflammatory. And it was causing heart attacks and all these heart issues. And eventually it was pulled off the market and Merck was just fucked up. So they threw a Hail Mary and they realized there's a market here for this, right? And good on them. Maybe maybe if they had done this correctly, they would have been our saviors. But as what typically happens in the development of these drugs or these injectables, we don't necessarily get the full picture as to what happens. So from a safety standpoint, I think it's important to start there. If you look at East Africa, so I did multiple years. I was going to Malawi in East Africa, a tiny little sliver, one of the most impoverished countries in the world. Their HIV, their HPV, all of that stuff is just raging, as it is in most of sub-Saharan Africa. Your risk of getting cervical cancer is 4.27 in 10,000 people. That's roughly 4 in 10,000 people develop cervical cancer. Again, a very, very small portion of the population. In the Merck safety trials, there was a risk of about 81 in 10,000 of a serious adverse reaction. And now we don't have to unpack that, but some of these, they range from, serious neurologic injury, like paralyzation, to seizures, to kind of like stroke-like symptoms, to there's a wide variety of things, autoimmune conditions. Yeah. So 81 in 10,000 of risk of a serious adverse reaction from Merck's own safety trial. This is in their package insert, guys. Like, this is not conspiracy. It's in their package insert versus a risk of 4.27 in 10,000. So we already have a very low risk thing happening, dying of cervical cancer. Now, 4.27 is the risk if you were in East Africa, like where we have way higher numbers. So if you're in the United States, that number is probably 4 in 100,000. It's so rare to die from cervical cancer. So you could get the vaccine and all comers are going to have a risk of 81 in 10,000 versus a very, very, very much less on a logarithmic amount, less likelihood of dying of cervical cancer. But we also see risks of autism, right? Like, this is multifactorial. For the record, I am not saying vaccines cause autism. I think autism is multifactorial. Mm-hmm. We do, however, know that many Alzheimer's patients, let's say there's a propensity for people who die of Alzheimer's, as well as people who die with autism, to have a concentration of aluminum in the brain. And aluminum adjuvants have replaced mercury in just the past 25 years or so as the stabilizing agent. It's
the adjuvant that initiates the immune response.
That's what they say. They say it provides a more robust immune response. And we won't have time today to get into original antigenic sin and all this other stuff. But the point being that aluminum is in there, and we're not even totally sure that it should be in there, or that it has to be in there. And certainly there should be some concern as to whether or not aluminum is part of the multifactorial problem that we see in the rise of autism. Back in 2000, 1 in 150 kids were diagnosed with autism. And of course, that is a wide spectrum. So maybe we've increased our diagnosis or our criteria or whatever. But in 2020, it was 1 in 36.
Yeah.
That's a 5-fold increase. So it's at least a question we should be thoughtful about.
Right.
Fertility. The miscarriage rate around our country is 10 to 15%. All comers. Women who were enrolled in the Gardasil trials that got pregnant while in the trial, the risk was 27%.
Of having a miscarriage?
Of having a miscarriage.
Yeah.
So that is a pretty darn big jump. I'd say that's a clinically significant jump. Mm-hmm. Autoimmune disorders, asthma, all of that other stuff is another part of the safety conversation. So can we say it's proven that they're unsafe? No. Is there reason for us to be concerned about what might be in it if it's not all that useful?
Yeah.
Mm-hmm.
Absolutely.
Yeah.
So is it useful?
And one thing I want to beautifully put, I just want to tack on to that there might be some healthcare providers listening, maybe even some gynecologists listening. I hope so.
I hope so too.
And something they might be thinking is, about the safety trials and the quality of the safety trials. Like, wait, they always do a placebo-controlled trial. So
Yeah.
they're testing the safety. And
I'm glad you're bringing this up.
It's important to know, to really look into the raw data rather than just taking, looking at an ad for Gardasil that a rep hands you in an office where it's like, yep, they tested for safety. Well, let's talk about that. What does that safety testing actually look like? When we talk about, they call these trials placebo-controlled safety trials. And a placebo, the gold standard of a placebo is an inert saline solution.
Mm-hmm.
That's what they use in most other sort of placebo trials. That's the gold standard. That's what the CDC admits. The FDA admits that that's the best. Well, in these trials for Gardasil, they weren't using a saline placebo. They were using an aluminum injection.
Right.
So what they were comparing was the HPV vaccine, Gardasil, with the aluminum adjuvant and all the VLPs and all the mush that goes into a vaccine. And the placebo was an aluminum solution. So every person in some of these studies was getting a hefty dose of aluminum in their body. Well, why do they do that? They have their own reasons, but what happens ultimately is that the actual safety data is now muddied.
Right.
Because you've given now everybody aluminum.
You have a focebo, not a placebo.
Yeah.
So if the placebo group, the focebo group has a high amount of adverse reactions, and the test group also has a high amount of adverse reactions, which was the reality.
Yeah.
It was about 46% in the placebo group. The focebo group had some sort of new medical condition in the year or two after the trial, versus the test group had 49% had a raise in new medical diagnosis.
So it's a wash.
So now they can see, there was only, what they do is they look at the difference. It was only 3% different.
Yeah.
That's not really statistically significant. So then they just wash that away and they say it's been safety tested. There was no significant difference in the groups.
Right. Right.
So these doctors, I feel for them because they're busy. They're reading, they're working with patients. They don't have time to read every study relevant to their work from start to finish and look at all the raw data. Like you were one of the busiest people on earth when you were, working in hospital.
Yeah. Yeah.
And I just feel for them. So they might be defending something that they actually haven't taken a microscope to.
Yeah. Yeah.
And so I think that that's a really relevant part to the vaccine conversation and the safety trials is like, what were they actually testing? It wasn't a placebo. It wasn't a saline placebo. So that's maybe you want to add to that. I don't know.
Well, yeah, I'll piggyback on that, and then we can talk a little bit about whether or not we did see. Maybe there are risks, but maybe we do see a really great boon to society for its prevention of cervical cancer. Just to add on to that a little bit, when we think about the placebo, these studies have been really, I think, fraught with. I'm not so sure that it's necessarily like. I'm willing to say, as a medical professional, maybe the intention wasn't bad. But I think it's really valuable for us to consider that almost every single one of the vaccines on the market has not been compared to placebo.
Mm-hmm.
And this is not something I love to talk about. Like, I hate this reality. But even when I was a first-year resident on my pediatrics rotation, one of the families there, I think I told you this story before, one of the families had asked me about, the vaccines and what about the hepatitis B? And I was like, honestly, I was an little intern. And I was on the pediatrics rotation. And so they were asking me about the vaccine. And I said, honestly, of all the vaccines, I'm not really sure I totally understand the logic behind hepatitis B day one of life. And man, did I get chewed up afterwards. And if you look at Recombivac's safety sheet, it's like 147 people were enrolled and they looked for adverse reactions for 5 days, didn't see enough. And so they were like, it's totally safe. And the FDA put it out there universally to be given to newborns day one of life. That was one of the earlier predecessors to my sort of, increased interest in this topic. But when these companies are developing these drugs, remember, Merck had lost $14 million. They were desperate to make this money back, and they threw their Hail Mary into this one device. And they needed to make sure that every single doctor out there was talking about this. They were paying lecturers. I remember reading a statistic, $4,500 per lecture to just give a lunchtime talk about how important this is to, community centers or to their, their
Planned Parenthood,
and corporate offices, like everything, like in every single doctor's practice, this was happening. And there was a ton of money invested into that. So I think it just, like, if you're having a reaction to this, whether you're a healthcare professional or otherwise, like, we're here to help people, guys. If something smells fishy, it is incumbent on us to at least go and make sure that we check our internal bias.
Yeah.
Like, am I absolutely certain that what I was told by that Merck rep, who was very beautiful and brought Panera bread for all everybody? I get it. Like, I know we all want to believe that everything out there is right. But now in retrospect, we're learning in ongoing litigation. I think it's in California. Two of the authors of the HPV vaccine on trial, Kim Mack Rosenberg and Mary Holland, they're working on litigation right now that is going to be available to the public around all of the vaccine injury claims. Like, there is enough for us, if we want to call ourselves scientists, to simply stop and ask, why is it not placebo-controlled, Merck?
Yeah, start there. Do that one thing.
Why? And there was one subset of all their safety trials that was truly placebo-controlled. It was one of a bunch. And everybody focuses on that one. It is placebo-controlled based on that one part of the data set, which, like you said, muddies everything. So I think that was really important to include.
Yeah.
And from a efficacy standpoint, the two things that I think are most relevant here is that this was advertised in the One Less campaign as like one less case of cervical cancer, one less person dying of cervical cancer.
Be one less.
And this was compelling to parents who I resonate, guys. Like, I hear you. I feel you. I'm going through this myself. Am I doing the wrong thing if I don't get my little girl's the Gardasil in 6 years for Penny? She'll be getting shot against cervical cancer. It's very compelling language. But one of the more compelling parts of this conversation around the litigation is they have not demonstrated that this prevents cervical cancer. A big part of that is the surrogate markers. So we can say maybe it prevents HPV, persistent HPV, maybe, but that's actually not what they were advertising. So instead of using just HPV, or instead of looking at cervical cancer, which you would have to do a 20-year study because it takes so long for this, cancer to develop. They used surrogate markers, which were SIN2 and SIN3. That's when you take the claw into the skin and remove a chunk. How abnormal is the tissue? How deep are these abnormal cells penetrating the skin over the cervix? And while that's okay, the problem with using that as a surrogate marker is that, as you mentioned, Mimi, most of this SIN stuff, even SIN3, which is the most advanced, the next step from that is invasive cancer, most of it goes away. It goes backwards. It gets better on its own because your body wants to live. So just a couple quick statistics. If you get HPV, up to 90% of it just goes away within 2 years. Younger, healthier non-smokers generally have a better fare at that. But 90% is a pretty darn giant chunk of our population. If you get the biopsy, right, the HPV doesn't go away, or the pap smear shows that it's starting to become a little funky looking under the microscope, then you go and get the biopsy. And if SIN1, that's the first degree, is the result, only 5% of those will progress to SIN2. So there, and again, you're in the 95% group, most likely. But our doctors overemphasize, hey, most people clear it. Well, what if you're not one of those people that clear it? We'll get into that. Like, how can we shift this law of averages in our favor? If the result comes back SIN2, maybe you had SIN1 last time and it came back and they did it again and now it's SIN2, up to 60% is going to go backwards. So your body is like really good at getting rid of this stuff. And even if it goes to SYN3, up to 50% is going to go away, go backwards or go away altogether. So using those as the surrogate markers is kind of unfair. It's like saying, it's like making a modification to your car in the event that you have to jump over like a water bridge.
Right.
Like, hey, if that water bridge, you're going to have the extra NOS, right? You're going to be able to nitrous or whatever, NOS.
Yeah.
You're going to be able to launch yourself over.
Yeah.
And it's like, well, okay, but
what are the chances
of that really happening? So, so since I think that's the first thing, is that we're saying, hey, it'll prevent you from getting this thing that is likely to be cleared anyways, especially if you've got some good coaching, maybe some directed supplementation, we're sleeping well, all the stuff we're going to talk about later. But then also you mentioned the negative efficacy. So what you were referring to, and I'll just kind of elaborate on it a little bit, is that they've done an RCT where they had women with HPV 16 or 18. So they came back as high risk HPV positive. They controlled them, and then they randomized them to a control group or an intervention group. And the intervention group was going to get Gardasil 9 after the original HPV infection. And those women in the experimental group actually had a higher risk of developing SYN2 or SYN3, meaning the something about the vaccine, either the vaccine harmed them in some way, which is kind of hard to imagine. But on the other hand, maybe it made them feel protected, and they were maybe a little bit less cavalier with doing some of those lifestyle things, or maybe they, maybe more partners or whatever. Like it's all mere speculation. But the point is that this Gardasil 9 thing is advertised as, don't worry about everything. Now you've got Gardasil on top. And it doesn't seem to have actually made much of a difference, and perhaps has done quite a bit of harm.
Yeah. This makes such a great transition into how do you, if 90% can support clearing naturally, how do you lean into this? And it's funny because as we're going through the various feedback that you might get from your doctor, one of them includes, hold still, come see me in 6 months. It's almost like they started 5% of the conversation, which should have been, let me see you in 6 months, because your body is this beautifully adaptive, immune supporting entity that has the capacity to heal itself. Let me explain to you the various modalities, lifestyle practices, mindset, supplementation protocols, community that you can now engage in to work with nature in clearing this HPV. And this is the white space, right? This is the massive white space that you both are jumping into. And so let's start the conversation. Maybe this is where we can start marrying some of the program meat that you've put into the Clear and Free program with what is available for folks to lean into this 90%.
Yeah. I think that's really great that you mentioned that the 90%, Nathan mentioned the 90%. Most people will clear this virus. 90% of people roughly will clear this virus within 1 to 2 years with no big deal, no major changes. And they come back and take a look at a year or two and see where they're at. But the person who just got diagnosed doesn't know if she's in the 90% or if she's perhaps in the 10%. So she's laying in bed at night wondering if there's anything that she can do to help her body. And these are, some of the flavors or the themes that show up in the messages that come to me is like, well, what can I do?
Yeah.
My doctor didn't tell me anything. And to be frank, there's so much that you can do. There's so much that you can do to support your body such that it is equipped and able to clear this thing naturally without any hassle, without any invasive procedures, without any injections. There's so much that you can do. And the way that I wanted to approach creating this course with Nathan, right off the bat, we talked about like, what is our intention with this? And for me, really, it's an invitation to evaluate your lifestyle on every aspect such that you can equip and give your body the necessary support so that it can do what it knows how to do, which is heal. You don't have to ask your body to heal. If you cut your arm, you don't have to do anything. Your skin knows how to heal. There's no difference between the arm skin and the cervical skin really in its intelligence, the body's intelligence of healing. And so it's like, okay, how do we remove the barriers, remove the obstacles to healing, maybe identify some things that can be tweaked here and there, and then add in some really good stuff, some research-backed supplementation, whole foods as your main source of nutrition. Hey, let's look at your mindset. Like, how are you treating yourself? Are you walking around every day with a lot of shame on your back for having this sexually transmitted, infection, or some call it disease, STI? What are you saying to yourself about yourself? Are you giving yourself time for stillness on a daily basis in this go, go, go society that we all live in? We are praised for working harder and sleeping less when we actually need the reverse to support healing. Working in and working out in an intelligent way. How are you moving your body in a way that is kind and restorative? Not just beating yourself up in the gym 7 days a week at Orange Theory. Like, maybe we can take a step back and sort of evaluate with curiosity and compassion. This isn't like a flogging exercise of, I'm not doing anything right. I'm doing all this stuff wrong. No. This is just an invitation.
Yeah.
And we all receive these invitations in different packages in our life. A moment to step back, take a bird's eye view of what we're currently doing in our life, and really asking the question honestly, like, is what I'm doing supportive of my goal, my dream, my objectives in life? And, HPV is just another one of those types of invitations. Our divorce was an invitation for me to evaluate, like, what am I doing? Is this working? Like, how's my mental energy? How's my emotions? How's my inner world? For some people, it's a death of a loved one. For some people, it's a different kind of diagnosis or a chronic illness or whatever. Like, we all receive these invitations to zoom out and with curiosity and compassion, evaluate the different aspects of your lifestyle that ultimately contribute to your expression of health.
Yeah.
So that's what really is missing from the mainstream sort of conventional model is support on every level: physical, emotional, mental, relational, spiritual. And that's ultimately what we created. I'll kick it to Nathan to add anything there.
I yield my time. I mean, that's very beautifully put. We love to think that, disease is like some sort of deficiency in something. And maybe that's true, but it's really, for me, it's like, listen, I'm just getting an invitation here to reevaluate some part of my life. And I do want to end up in that 90%, for whatever condition, hypothetical 90% for every other thing that we're worried about, developing. Cancer, of course, is something we all have to think about.
Yeah.
For men, it's other types of cancer, in general, but, thank God we get these signals. Thank God that it's like a little reminder, I'm in adrenal fatigue like I had in residency. I'm not in now, but back then it was like, I have abs, I'm ripped, I'm golden bronze from being in California or eating organic food and all this stuff, but I was only sleeping 3 hours per day because that's all the time that I was afforded. And sure enough, my wheels were falling off. So it was like, oh, thank God this happened now and not when I have kids. Because I could really evaluate the importance of rest and relaxation and Dr. Quiet, in order to keep myself going. So thank you for that. I think that's a really important reminder is that, hey, there are a lot of things out of your control. But if there is something in your control that can take those numbers that we gave and improve them even more in your favor, then you have to worry about being in the 1%, not the 10%. That's a big difference.
Yeah.
And hey, you might get your libido back, and hey, your connection with your partner might get better, and you might feel like going to the gym again. I mean, or you might just live longer. Who knows?
Yeah.
That's a really good point. This program is of course centered around the conversation on HPV. But this isn't an HPV program. This is really a holistic solution to support you in preventing, like you said, all these other things that we have to face. Diabetes, cardiovascular disease, cancer, like these big killers. The puzzle pieces are pretty much the same for this term that we use in the program, and we teach about salutogenesis, which is, the body knows what to do. The body knows how to heal. If we are removing the sort of the barriers to healing and adding in some more, maybe replacing with some good stuff, some better stuff. And so that's something that I really want to drive home. That's like, yes, this is a program that's centered around HPV statistics and everything, but this will also help you for the rest of your life.
There's a few things, if you guys don't mind, I'd love to drill in on a little bit further. And if you don't mind teasing just a bit about what the program offers from these sort of pillars, if you will, from the program itself. I'd love to talk about food. I think that's one that's just so applicable to everybody. I think it's worthwhile to get into medicinal mushrooms and how important they are in this specific program to the healing and the clearing journey. And arguably, maybe most important, the emotional mental component of this, the shame aspect that's been associated and attached to HPV. And so I'd love to get into that a little bit in detail. So maybe we can get into some of these pillars.
You mentioned food as medicine, nutrition as medicine. And this is obviously very, very important. These are the big rocks. We can talk about the granular things like cold plunge, like sauna, like meditation or transcendental meditation, whatever. Those are the tiny rocks. Let's talk about the big boulders that need to be in place if we're going to support our body fully. And there is no aspect more significant than what we are feeding our body in the form of nutrients and how we are gifting our body the necessary tools to make things like proteins, to rebuild cells. And what I find a lot, the women that come to me, they're confused because what they're saying is like, I don't get it. I'm so healthy. I'm a vegan, or I'm a vegetarian, or I do Whole30, or I work out every day. I don't get it. I'm so healthy. How did I get this?
We hear this a lot in pregnancy too, where it's like, I'm so healthy. How did this happen? And it's like, well, do we have the boulders in place?
Yeah. And so a lot of times this can be sort of an archetype of a woman. And I know this so well, this orthorexic state where your healthy habits get to the point where they're kind of severe such that they become unhealthy. It's too strict. You're not actually maybe getting enough calories. Maybe you're working out every day and eating so strict and lean that your body is in a deficit for years.
Or you do a juice cleanse once a month. And although that can be on occasion a great clearing, isn't necessarily something that should be sustained over a long period of time.
Yeah. And so, when we talk about food, it's like, the holy grail is all organic whole foods and pasture raised eggs and meat and organ meats, things that are very nutrient dense that you're gifting your body so that it can rebuild. This is not a time to be restrictive. I don't care if you have a Vegas vacation coming up or a bikini shoot or whatever. This is not a time. We've all done it. We've all been there. We've all restricted for an outcome. That's like, I just got to tighten it up a little bit for this or for that. And there is this epidemic in diet culture. And I've spent most of my life in that space. Thankfully, I'm out of it. But this lie that women are told that we need to be smaller. I'm not saying that obesity is the answer. I'm saying that we're fed this lie that you need to have abs, you need to have, big boobs and a big butt and a tiny waist. And there are these trends of female beauty that come in and out of style. Right. And women sort of triangulate their food and their lifestyle habits based on what is in style at that time. And I've been there, I've done it. And so
Can I add something real quick?
Yeah.
Because there's a lot of women out there who are actually overweight, and they're way healthier than people that are on these like very restrictive sort of lifestyles. And that's, sort of reflected in my pregnancy and childbirth care, is like, just because you're overweight doesn't mean you're unhealthy. If you are overweight or underweight due to, otherwise modifiable things in your life, either of those extremes are not necessarily in alignment with the optimal function of your immune system or your body and your multiple organ systems in general. So, what we're not saying is that either of these extremes make sense, and what I really want to impress upon people, in addition, you'll get into this, is that what we can do with diet also doesn't require that you go to Erewhon and spend $20 on a smoothie in LA. It could be some very, very basic things that you're taking out and just replacing with fresh produce or something like that. This doesn't have to break the bank. But it is important to step back and really evaluate, what am I eating? Is there any little thing that I can do better? Am I happy with my weight? Am I being too restrictive? Those are good questions to ask.
And it's a big conversation. This isn't just like a quick thing. The changes can be small, but there's a lot of education that we go into. We go deep into the different nutrients that your body needs and what foods contain those nutrients. And we literally give you a breakdown of like foods to focus on and maybe ones to avoid a little bit. So that's a huge aspect of the program is nutritional guidance. We're not making a protocol for you. We're not giving you a checklist, a grocery list. You need to use your body as a feedback system. And understand what foods work for you and what foods don't, how you feel afterwards. So we get into a lot of the nitty gritty inside the program.
What I love about this, and I know you get into movement as well. So you've got food and movement, nutrition and fitness. And in the health space at large, we are at a loss for some critical components to the fitness and diet, the movement and food conversation that include accountability, that include community, and include relationships. My healing journey in my life was only seen when I included these other aspects outside of just the food, just the movement. It's an intelligent, specific, nuanced protocol or program that has worked with the bio-individual person in their own journey. And that's what I'm so excited that you guys get to showcase. Want to also talk about maybe the quarterback to this program, the team that you're showcasing through this program. That is the use of medicinal mushrooms. And I've seen it from you. You've literally traveled to Japan to meet the experts in this realm to validate the science that's supporting what has come out with AHCC specifically, which is this really incredible derivative of shiitake mushroom. And if you're familiar with the medicine podcast at all, you know that we've been massive advocates for AHCC over the years. But maybe talk a little bit about, you mentioned it before, research-backed studies pertaining to AHCC and its use for supporting the body's ability to clear HPV.
I love your analogy or your metaphor of the quarterback, because you do need the whole team. The quarterback is just one piece. He can't win the game on his own, right? Like you have to have these other players. So AHCC is one piece of the puzzle, but it's a very, very, very important piece of the puzzle. And it's research backed, clinically research supported. And so the specific study that you mentioned, and I mentioned it earlier in my kind of introduction and how I got into this work, the study that was published came out of Texas. And what they did was they got about 50 women with high risk HPV, and they separated them into a true placebo group, a real placebo, and the test group, the experimental group that was receiving AHCC.
So no aluminum in the control.
No, they did not. Okay. They left the aluminum out, thank God. And so what they did was it was double blinded, so no one knew who got what. And the test group, the experimental group, received 3 grams of AHCC per day for 6 months. The placebo group received an inert sugar pill for 6 months. And then they looked at, okay, who's clearing HPV. And the test group, just phenomenal results. 64% of the women who were receiving AHCC cleared HPV in 6 months or less.
Mimi, can I jump in there?
Yeah.
Because I'm a doctor listening. I have no financial investment in Immune Intel AHCC, or like I have absolutely, I care zero fucks. However, I'm also a clinician. And like I said before, I care for people. When I heard that, when you sent me the paper, because I was still like a little skeptical, right? But then I started giving it to people, and I was getting these great responses back. And when you read that study as a doctor, you can push back in every which way on every woo-woo, esoteric, whatever, holistic, health coaching, blah, 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 blah. When you see a study that has shown it will help the person who's in there with their legs in stirrups, underwear off, and they're trembling at the thought of this progressing. If you do nothing else, why not consider something? Forget the vegetables and grass-fed beef even. I don't think that you're going to be doing them a great service by leaving out all the other stuff that helps Immune Intel do its work. But when you see it in a peer-reviewed journal, done with rigorous study, in people, not even just in rodents or something, which is what most of our research is done on.
They did those too.
Well, they did a ton of studies. You have to just like be thoughtful about what this could mean to your practice. Again, I'm not making money by saying that. I am here to help people so that they are not coming back to me with the fear that these screens are going to come back positive or that they're going to end up with cervical cancer. There is really compelling evidence here for this.
Yeah.
Go on.
No, thank you. That was perfect. So yeah, they saw this huge number of women clearing HPV with the support of this product, AHCC. And it does, you mentioned it comes from shiitake mushrooms, and it's a patented process where they culture it over the course of 60 days-ish. And it's really unique. We call it the mushroom unicorn because it is one of one. It's one of a kind, this patented process that they have. And through this process, AHCC becomes more bioavailable and more absorbable by the body because of its molecular size. So the body is able to take it in and process it more effectively than, say, other medicinal mushrooms. Or if someone was just to eat a bunch of shiitake mushrooms, that's not how it works. It's not comparable. So it's really helpful in amplifying the innate intelligence that exists in the body with, by the way, zero negative side effects.
I haven't heard of any yet.
So, in comparison, I said 64% of the women in the test group cleared HPV in 6 months or less. That's not counting the people that cleared it in 7 months or 8 months. Everyone's different. Some women were 2 months. Some women were 8 months. That's just the time frame that they put in the study. In the placebo group, only 2 women cleared on their own out of the 19 that were receiving the placebo. So that's a huge statistical, very significant difference between the placebo and the test group. What they did then was they unblinded it and said, okay, this group of women, hey, you didn't receive the AHCC, you're still positive. Do you want to take the AHCC now? And 12 women accepted. And over the course of the next 6 months for them, 50% more were cleared.
Wow.
And that's in and of itself, that number, the 64% and then the 50%, huge, amazing. But they also didn't change anything else in their lifestyle. They were instructed not to because they just want to count for one variable in clinical research. And so what could that number have been if they would have maybe gotten some guidance around nutrition, around movement, around mindset, around how to relate to their partner about this very difficult topic of this sexually transmitted infection that probably also is affecting their partner.
Right.
What if they would have changed just a little bit in these other bolder areas of their life? So, like I said, AHCC is an important piece of the puzzle, but it is just one piece.
Yeah. And so I love that we're talking about these big pillars and food and movement and fitness and nutrition. And in the program itself, the specific protocol is baked into the program itself as it pertains to using AHCC as a complement with these other modalities. I think there will even be an opportunity to access Immune Intel AHCC through the program.
Yeah, everyone who participates, every participant will receive, if they want it, their first bottle of AHCC free. Because I want to make this so easy for people to get started right away if they want to from the very beginning. Now they have to participate. They have to, put their address in and put in the discount code for 100% off. But everyone will have that first bottle free and they can get started immediately with this very supportive medicinal mushroom product. And the last sort of big boulder that I want to talk about is, you mentioned the emotional, the mental, the shame piece, which is another just huge, heartbreaking piece of the conversation. And I've mentioned it a little bit, this shame that's carried, kind of baked into this diagnosis. And yeah, it is absolutely heartbreaking that women feel so alone. They feel like they can't talk to anyone. Many times I've been told, you're the only person I've told in my life that I have HPV. Me, a stranger on the internet. And that's fine. I'm happy to hold their hand and to help them, to guide them. But it's a problem if we feel like we can't even tell the closest people or our partner who we're having sex with. How do I tell my partner? Did he give it to me? Am I giving it to him? Who did he get it from? I've spoken to women who were virgins when they got married and they still got HPV from their partner. I've spoken to a very dear friend of mine. I'll keep her anonymous, but a very dear friend of mine got an HPV diagnosis after the first time that she had sex when she was like 21. So it's not this dirty infection, shameful thing that society has kind of put this label on. It really is like anyone and everyone can get this thing. So a big piece of the course is looking at the shame piece, looking at where that comes from. What is that rooted in? What are the stories that you're telling yourself about yourself? How do we start to release some of the shame and get you into a community of people who know exactly what you're going through? Alongside myself, I've talked to thousands of women at this point who come to me who are desperate. Nathan is a professional in this space. He sees this all the time and talks to women all the time about this. You are in good company.
Yeah, you're not
alone. And we're here to support you. You are absolutely not alone. And every other participant in this program knows exactly where you're at, what you're going through, what questions you have, and all of that. And so the community aspect is very, very important. I think it just for humans in general, we need community. Yeah. We are not meant to navigate every difficult situation and circumstance in our life alone. And so that's part of my mission. Just why I think I was put here, why I exist, is to help women with this release of shame, because I know how you feel. I've been there in my own life. I've carried shame for years, and I want to share what has worked for me in releasing shame around sexuality, around your body, all of that. I could keep going on, but I'll stop there and let Nathan jump in here if you want.
Yeah, I just want to riff a little bit on the shame thing. We see shame as just this, this sort of like, oh, this thing happened, like, let's talk it over and get through it. But like, a lot of us carry shame for a variety of reasons. A lot of us carry chronic stress for a variety of reasons. The biggest one is probably relationships and finances. A lot of Americans in particular, despite us being such a rich country, have so many people that are stressed out as to how they're going to pay their bills and all of that. And when we look at, even minorities or people of really across the spectrum, people who have tremendous stress, whether it's through shame or whatever, it could even be self-imposed through all this stuff we've already talked about, like restrictive eating and whatnot. This does impact how your immune system works. Mm-hmm. And to sort of illustrate for people maybe a slightly different I don't know, perspective on stress. I think most people, when they think of the autonomic nervous system, you've got your sympathetic, which is your gas pedal, and your parasympathetic, which is your rest, your brake. So we've got flight or fight, rest and digest. But through the lens, I've been studying through with the Prana Foundation, polyvagal theory. And when you look actually at the nervous system in more complexity, you see that the parasympathetic actually has two giant branches. The first is your freeze. It's the I can't message. That's your dorsal vagal nervous system. And in the uterus, this is what develops first. The baby's heart rate is a lot lower than you would normally hear it with the Doppler. Then, as the baby develops, they develop their sympathetic nervous system, and you see a spike, a boost of their heart rate up. That's the gas pedal, right? Well, the ventral vagal part of the parasympathetic, it's basically all the vagus nerve endings above the diaphragm, if you want to simplify it. That actually leads to the I am. So sympathetic is I can, dorsal vagal was I can't, and now the ventral vagal is the I am. That's when you are motivated to just show up in the world. Like, we all know what that feels like. And as you get older, I think that you sort of lose sight of that. But little kids are living in that. Like, they are just embodied little Buddhas. So the reason it's important to consider these various parts of the nervous system is that even when a baby is born, a baby needs to feel safe through that motherese and through all the little goos and ga's and like us holding them. And, right after birth, I've talked, everybody's ear off about what hospital birth looks like compared to home birth. But a great reason that kids born at home and mothers who give birth at home are doing so well is because they can start that co-regulation process immediately after birth without the sharp needles and the bright lights and all this craziness, the noises and everything in the hospital, which probably doesn't feel safe to a little being that has just come earthside. So little kids who grow up in environments where they don't have a lot of parental attention, they're not able to be held by mom. Maybe they were in an incubator for 2 months of their life. There is absolutely a mechanism there behind which that little child is not going to develop in an optimal way. Guys, I'm not saying that preterm babies are all like doomed or anything. What I am saying is that if there's anything we can do to make a baby feel safe, whether they're in the NICU or not, we're going to benefit the completion of the development of their ventral vagal nervous system. And so back to chronic stress, if a person is chronically stressed, they may find themselves slipping down this autonomic ladder. Again, ventral vagal at the top, I am. Your sympathetic, I can, and then your dorsal vagal, I can't. If a person doesn't feel safe, it does demonstrably impact their nervous system. And before a person can connect, whether it's intimately or otherwise, developing deep friendships like we have, you have to feel safe first.
Yeah.
So the shame and everything that we throw at people may throw them down the autonomic ladder. And that actually indirectly, I'm not blaming people for this, but if we continue to perpetuate this conversation around shame and blame and all this other stuff, whether it's around another pandemic or it's about what's happening at Burning Man or it's happening politically, we are not going to be able to connect with one another.
Yeah.
And our world is desperate for connection. And so the same things, the rest, the slowing down, the being present, the holding one another, the touching your babies, all of that, not isolating ourselves. I'm not trying to not go down that path, is actually impacting our nervous system. It's impacting our immune system, and it's leading to greater disconnection in perpetuating the story of shame and blame. Our community, I'm hoping we can create a very safe space for people to start rising up the autonomic ladder and become motivated and find resources and find community to squelch this problem and to kick that shame language aside, because it's not serving anybody.
Right.
No, absolutely not. Yeah, that was beautiful. Thank you.
Thank you.
I think one of the most beneficial things to this program will be the community.
Yeah.
And I've seen both of you in your work directly with people. I mean, the feedback that you've both shared with me, it's that very sense. It's that I don't feel alone.
Yeah.
And maybe you can get into some of the specifics of what the community will be doing through the program. The fact that there will be an ability to communicate very openly with both of you, with each other, and how that can practically look as one partakes in the Clear and Free program?
We will be having, for all the participants of the course, we will be having monthly calls, group calls. You can join. You don't have to join if you don't want to, but you will have direct access to us and the group to ask questions, to feel supported, or just like to vent, to talk. We're going to have different holistic health experts coming on. We will have some calls that are just Nathan and I, but we will be inviting other people in as well to come and speak to a specific aspect of holistic health. So those will be really fun to have those guests in as well. And then when you sign up for the program, you will also have an opportunity, if you want to schedule a one-on-one call with either myself or Nathan. So if you feel like, this is great, I'm going to do the program, but I also just want to talk face to face with just you or just Nathan, you'll have that opportunity as well. So we are coming at it from every angle. If you're a visual learner, if you're an auditory learner, we've created customized guided meditations for hopefully your regular stillness practice. And so whatever way that you like to learn, whether it's one-on-one or in a group setting or just on your own with your laptop, we got you. We wanted to come at it from a bunch of different angles. And if I could, I do want to just share one more testimonial that I received recently that just touched my heart. I want anyone out there who's listening, if this is resonating, if you're in this space, if you're navigating the integration process of the HPV message, let this be a note of encouragement to you that it can be done. There are women that are doing this all the time, every day. So this testimonial, she says, I'm crying as I type this. Just 6 months after messaging you, I got news from my doc today that my body has fully cleared HPV and all abnormal cells. It feels like a miracle, but I know it's the combination of taking Immune Intel AHCC, improving my lifestyle choices, treating my body with love, and believing it could and would heal. I have so much gratitude for you, the support you provide for women, and sharing this incredible option to further support healing.
I love that.
I just love it so much because it's just a perfect representation of someone who took the initiative, took ownership, wasn't flogging herself, treating her body like a friend she was meant to help.
Oh, I love that.
And looking at it from every different angle. Yes, she had the AHCC, but she also was believing in herself. She was taking action every day, making small changes, speaking to herself differently, incorporating more stillness, being kinder to herself in her exercise and movement. And all of those puzzle pieces came together. And after 3 abnormal PAPs, only 3 months of that change and that tweaking to the lifestyle, she's completely healed. And I hope that we have 1,000 more of those testimonials.
I think we will.
My goal is for us to help save 1,000 cervixes. Like, I would love that.
Me too.
Yeah.
God, that's a lot of cervices. That's
great.
Cervices,
is that the plural?
I think it is, but I wasn't going to correct you.
Yeah. So if anyone is interested in this program, if you want to learn more, you can obviously reach out to Nathan and I. We are here to support you, to guide you, to help you. But we also, in addition to the program, we also have a free resource that we created that is free and that anyone can go and download today to start this process of evaluating your lifestyle. It's a 13-page document that Nathan and I created, and we'll put the link in the show notes. And I just encourage anyone, whether you're thinking about the program or not, if this is something you're navigating, please just download that freebie. And there's a ton of information that it kind of lays the foundation of what's to come in the program.
We'll have the 13-page document in the show notes for everybody to get a hold of. As far as timing of the program and when it launches, how can people mark their calendars for when this thing goes live?
Yeah. So right now you can join the waitlist if you want. We'll have that link in the show notes as well, or you can, simply download the freebie. So you can join the waitlist anytime you want. It's now about mid-October. So you can take action today if you want. We will be launching and starting courses open in the beginning of November. November 6th, I believe, is the launch date. But right now you can take action and join the waitlist if you want.
Yeah, we won't leave anybody out. And one last thing I want to add to what you said is that bear in mind, for those women out there, you're going to be screened. Your doctor is going to be interested in screening you for these things until you're well into your 60s. So we're talking health span, we're talking lifespan, we're talking about a long-term plan for you to make sure that this is not something you have to worry about. So whether or not you are actively working through some of this stuff, or if it's something that you're thoughtful about for your kids, for your wife, for yourself, there is something here for everybody. We actually even included some information in there directly for the men, so that you can have a little bit of, guidance as to how to communicate around some of these intimate topics with your partner. We want everybody to be included here. And when you come to us, we will definitely work with you in some way to make sure that everybody who really, really needs this can get in. And we're just so grateful to, I'm kind of also grateful for you for pushing me along so we could finally get this out there. Cause I've been champing at the bit to be able to give this to my clients and my family and all of my patients. I'm just really stoked that we now have this option out there for people.
Yeah.
I'm so grateful for you both, having witnessed both of you with countless one-on-ones, with countless consultations and coaching, and just the sheer volume of people needing something like this program, to have had both of you think outside the box, to know that you had to collaborate, and to come up with something that can have the most impact outside of just chopping wood one by one through coaching and consultation, that this is such a solution that exists in a white space that is needed for society. We're talking about 80 million people, and it is being unaddressed from the perspective that both of you have been taking with this. And so just huge props to you both. If you're listening, this is such a relevant topic. This is such an important conversation. Even if you don't know of anyone directly in your life that has HPV, there's a good chance that they do. It's okay to bring this up. Mention that you've listened to this episode. This is fascinating stuff. This is important. This can be an inclusive conversation.
Yeah. Share this episode on your Instagram.
Share it on your Instagram.
You have no idea the amount of people who have come to me and said, my friend shared this Instagram reel or post, and I found you through my friend that shared.
Yeah.
You have no idea, just because your friends and sisters and cousins aren't telling you they have HPV. This is how we create movement and change in this space, is by people passing it along. Yeah. Especially when the people who are positive are kind of buttoned up about it. And they have that right, of course. So it's really helpful if you just share this, maybe send it to someone you know or love, share it on your Instagram, because you don't know which of your followers is Googling that day, how do I clear HPV? Scary. What am I going to do? You have no idea who's navigating that. So I'm humbly asking, to help us in this mission to save more cervices. And you listening can be an active participant in this awareness growing around HPV. So thank you in advance for helping us.
Incredible. Any last words, my friends?
I want to say again, I've told Nathan 1,000 times, but I am just so honored to work with you on this project. And not only that, just to witness you and be around you and to call you friend. You're just such an incredible light. And I honestly don't know of a bigger advocate for women and cervical health and birth experience, just all around the woman, the female experience. I just don't know a bigger advocate. And I'm just so grateful and honored to be with you in this journey.
Likewise, my friend. I love you.
Love you too.
Thank you so much, everybody, for listening. Share the episode, start the conversation. Let's get HPV awareness out there. There are solutions and there are communities that are going to be taking this thing into the next realm of healing
Yes.
and vitality. Sending everybody so much love, and we'll see you next time.
Bye.
Bye.